Hi, Ada. I'm medical doctor AJ. What brings you in today?
I have burning chest pain after every time I eat and need to use 3 pillows sleep at night to relieve. Sometimes I feel nausea. What can you help me with that?
Ada, it sounds like you are suffering from what we call GERD. That stands for gastroesophageal reflux disease. I know the word disease sounds really scary, but let's not think about it that way. Let me explain. GERD occurs when the contents of the stomach, including gastric juice and/or duodenal contents, regurgitate into the esophagus, causing heartburn and discomfort. The main physiological process that leads to GERD is transient lower esophageal sphincter relaxation. In Canada, an average of 5 million people experience the symptoms of GERD, including heartburn and/or acid regurgitation once per week. We have a couple of treatment options that we will discuss. How does this all sound?
Great. Let's talk about the treatment plan.
Well, Ada, Canada is the 12th largest consumer of indigestion and heartburn remedies in the world. In 2008, Canadian sales were $164 million. Proton pump inhibitors are a main source of drug therapy to ameliorate symptoms in patients. They block the production of stomach acid through a pump called the hydrogen potassium ATPase pump. One of the most commonly prescribed proton pump inhibitors is omeprazole. Omeprazole is available in dosages of 10, 20, and 40 milligrams. Recommended usage is 20 milligrams daily up to 4 weeks. The FDA advises that no more than 3 14-day treatment courses should be used in 1 year.
Great, but I'm a little bit concerned about side effects.
I'm so glad you asked, Ada. Unfortunately, 42% of Canadians that use proton pump inhibitors for GERD were dissatisfied with the outcome. Negative side effects of taking proton pump inhibitors were nausea, diarrhea, headache, insomnia, and anaphylaxis. Some concerns associated with the use of proton pump inhibitors include failure to respond, rebound gastritis, atrophic gastritis, H. pylori, or C. difficile infection, and other drug-induced side effects. Also, it is important to know that stomach acid is required for the absorption of certain nutrients, such as vitamin B12, and proton pump inhibitors have been shown in some studies to affect the absorption of magnesium, iron, calcium, and B12. In spite of these findings, the most important take-home point is to keep your GERD under control, as a long-term consequence of uncontrolled GERD is Barrett's esophagus, a condition in which the lining of the lower esophagus changes tissue type, and it has a strong association with esophageal adenocarcinoma.
Wow, that sounds kind of scary. What are my other options?
Hi, I'm naturopathic Dr. Adelia. Melatonin is a common alternative to proton pump inhibitors that has been commonly named as a treatment for GERD. However, one of the only well-done studies on melatonin, Candil et al., had some flaws. Firstly, patients only receive melatonin for a duration of 8 weeks, so we can surely not consider this long-term. Secondly, stress levels have been found to be correlated with GERD symptoms, and the study failed to assess the patient's level of stress throughout the treatment. The study also failed to follow the patient's dietary habits to determine possible trigger foods. Lastly, the study did not mention location. Where the study was performed in terms of cultural practices could have a large impact on dietary habits, stressors, and stress management. Overall, the design of the study was lacking in terms of number of participants. 36 patients, meaning that the group taking only melatonin was a total of 9. The results could have carried higher statistical significance had the authors been able to recruit a larger number of participants. In addition to melatonin, other natural methods that may be used in the treatment of GERD are acupuncture, a low-carbohydrate diet, and the following supplements: Chinese honeysuckle flower, spearmint, and iberogast. The low-carbohydrate diet has not been studied on a large scale, but 2 trials showed that a small number of people who followed the Atkins diet were relieved of symptoms within 1 day to 2 weeks of starting the diet. The second study resulted in 68% of participants reporting improvements with dyspepsia GERD while following a low-carb diet. In an RCT similar to Candil et al., researchers compared GERD with 2 treatments, the first being omeprazole and the second being a cocktail of melatonin, L-tryptophan, vitamin B6, folic acid, vitamin B12, methionine, and betaine. The results showed that all patients taking the cocktail reported a complete regression in symptoms after 40 days of treatment.